housekeeping items. We will be filming this presentation, but we are going to only film Dr. Ali speaking. We will not film the question portion of it because we want to just be sensitive to your questions, but we do want to make that available at a later date in case people want to view the presentation. We also want you to take stuff. So besides the food, we have some notebooks up there. These are, I feel like this is the perfect audience, parents. These are Band-Aid and Neosporin kits. So one in your purse, in your car at all times. Please walk home with one of those. And then we also have some rack cards up at the front as you're leaving. Lots of primary care physicians, if you are not signed up with someone already or your child needs to see someone, please feel free to take those. And we also have a physician who helped co-author a book, which we thought was appropriate for tonight. It's called Fun is a Feeling. So we have a stack of those up there as well. And Dr. Whitaker would love for you to take one of those home. So lots of good swag. Before we hear from Dr. Ali, I did want to share a little bit about the Island Health Foundation and our longtime commitment to mental health in our schools here in Anacortes. So the foundation raises funds to support Island Health and its commitment to community health. That's our mission. We fund life-saving equipment, scholarships for nurses and staff, facility updates, important services like our community paramedic, a social worker in our emergency department, and health education classes. And for more than 15 years, we have been committed to providing direct, free, and confidential mental health support for students through our school intervention program. You may have known of it as Mental Health School Intervention Program, then it's been called SIP. So that program has transitioned. This award-winning SIP program removed barriers to mental health support for adolescents by placing Island Health social workers in Anacortes High School, Cap Sandy High School, and Anacortes Middle School. But recently, this innovative model was adopted by the Northwest Educational School District. And today there are 26 mental health professionals that have been placed in Skagit County and surrounding areas through the Northwest Educational School District. So really expanded, and we're so excited to have Northwest Educational School District as part of the team. Today, with the help of Island Health Foundation funding, NWESD has placed 2 mental health professionals in the Anacortes School District, one to cover the 3 elementary schools, and a second to cover AMS, CAP, and AHS. These professionals work with our school district and our school counselors and professionals, including Dr. Ali and all of us at Island Health, to make sure that we're addressing student mental health needs. At the same time, Island Health continues to provide additional mental health services, including that community paramedic, our social work and ED, and of course, crisis management and zero barriers in clinics. So the collaboration between the foundation, Island Health, and Northwest Educational School District brings me to a couple of introductions. The first person I want to introduce to you all is Danny Johnson. Danny is a mental health specialist with NWESD, and she is a visiting professional in our school district. She works with Mount Erie, Fidalgo Elementary, and Island View Elementary Schools. And Danny's position is one that the Island Health Foundation is helping to fund. So we're really excited she can be here and put a face to the name, so you all know to look for her. With her is Chris Allen. Chris is a behavioral health administrator with Northwest Educational School District. And then the other name that I want you to have sort of is Colleen Chan. And Colleen is our NWESD person in the high school, middle school, and CAP. So I also see Treva King here, and I just want to recognize how fortunate we are to live in a community where additional, robust mental health supports for all students are provided through the Anacortes Schools Foundation and other organizations, including Communities in Schools and a couple of others. Also joining us tonight is our superintendent. Where did Dr. Bruner go? Carl Bruner is here as well. AHS Principal Aaron Dewey is here. Thank you for being here. And then there are also a couple of members of the Island Health Foundation Board. Daryl Hicks is our president, and Sandy Norris here as well. Did I miss any of the other board members? Excellent. Also from Island Health, I'm going to be introducing Elise Cutter in a minute, but Laura Maroney is here. Thank you for being here. And my team Pearl Peterson and Mason Cole, both Anacortes High School graduates. Mason was born at the hospital here, both 5th generation Anacortes. So if you have any questions about pretty much anything, Pearl and Mason. I also want to mention Patty Codd, who is here from Island Health. Patty has been the backbone of the SIP program and mental health supports at Island Health for years. So I want to thank Patty for her innovation and dedication and all you do to continue to support our kids. So thanks, Patty. So joining us tonight, as I mentioned, is Elise Cutter. She is the CEO at Island Health. Elise has been with Island Health for more than 20 years. She has 3 children who have all gone through the Anacortes school system, one that's still in the school system. We are fortunate to have Elise and a board of commissioners at Island Health who are truly steadfast supporters of youth mental health. And so we feel really fortunate to have that support on our team. So whether you're here with questions, you're seeking resources, or you're simply wanting to learn more, we're so glad you came, and we're excited to continue to work together to ensure that every child in our community has the support they need to thrive physically, mentally, emotionally, and socially. Thank you again for being here. Let's get started, and please join me in welcoming Elise Cutter, CEO of Island Health.
Thank you, Marta. Thank you all so much for being here and giving us some time. I know time is valuable. We all have busy lives and families, but this is a topic I personally am very passionate about. Oh my gosh, that picture is big, Marta. Very passionate about making sure there are mental health services in our schools. As Marta mentioned, I have 3 children who have all gone through the amazing Anacortes School District. One is a senior this year. And I just want to tell a brief story because I know you're all here to hear Dr. Ali, but I just want to show you the impact of our school intervention program. So again, 15 years ago, Island Health had a vision in working with the Anacortes School District to get mental health services in our school district. And after a few years, one of my kids, I was asking them like, hey, do you know much about with your counselors and the mental health counselors that are there through the hospital? He's like, yeah, not really. And then I asked again about a year later, and I said like, hey, if you ever had a concern or you see one of your classmates struggling, what would you do? And he said, well, you tell the counselor so then they can go see, he of course didn't say the Island Health, but the therapist that's at the school district. And I said, oh, is that a big deal? He's like, no, that's just what you do. So within a matter of a couple years, we normalized getting mental health services in schools with a 0 barrier. Took that stigma away. Does it exist? Probably a little bit, but that was just a personal experience of how we were able to normalize that and make it like, of course your mental health is just as important as your physical health, which is as it should be. So again, I will turn it over to Dr. Ali, but as a rural community, I will just say we are so fortunate to have the resources that we have. Most hospitals our size do not have a child psychiatrist, child and adolescent psychiatrist at the district. So we are so fortunate to have Dr. Ali and the counselors that we have. The partnership with Northwest ESD is amazing. Although we pioneered this, people looked at this program and said it works. Embedding mental health services in a high school and a middle school makes a difference. And now we have funding from other sources as well as our foundation. And Island Health does more than just have a presence in our school district when it comes to mental health. As Marta mentioned, the foundation helps us by putting a MSW or Master of Social Work in our emergency department. Because as you can imagine, folks in mental health crisis show up in our emergency department and we need services there. So they make that possible because the reality is mental health is sorely underfunded in our healthcare system. It is a fact, and we need organizations like our foundation and the Anacortes School District Foundation to help support these services that are important, but again, are grossly underfunded. So with all that, thank you to our foundation, thank you to Northwest ESD and the Schools Foundation for giving us time tonight and supporting the mental health services for our students and adults in our community. We could not do it without you. And without further ado, I'm going to turn it over to Dr. Ali so he can talk to you about, is my kid okay? So welcome, Dr. Ali.
everybody. I'm Shad Ali. It's Shad like Todd. My last name is Ali like the boxer. So I'm a child now psychiatrist. I like to tell kids that I'm basically just a feeling doctor. That's what I do, is I just talk to people about their thoughts and their feelings and behaviors. I was recently asked by someone like in Anacortes, like where my accent is from. And I was telling them like I'm from this exotic place called Denver. That's in case you're wondering. I see Melanie, who this is like her turf, and just want to say shout out to all the people here that are involved in mental health, counselors, teachers, and so forth. Like, thank you for all that you do. I wanted to be provocative, which is why I said, is my kid okay? Because I can't really think of a more, I guess, anxiety-provoking question than is my kid okay? And I think a lot of people really focus with is my kid okay about like, oh my God, do I know the answer? Like, is he okay or is she okay? But I don't think the answer is important. I think the question is important, right? Like, are we really in touch with the people in our lives? Because you're gonna hear me talk a lot about like connection and emotions today, which I think is really like the essence, right? We live in an age where isolation and distance are kind of like the way things are headed. I think the idea really is like connection. And this question, is my kid okay? It's a very reasonable one. And it's a question that every parent should ask but not be afraid of. Because the idea is, if you can, when we ask a question like, you know, is Elise okay? I'm asking to reach out for connection. I'm asking because I care, and that goes such a long way, because really what I'm gonna talk about today, and like the essence of what parents should know, is connection is everything, and emotion is everything. And if we can make that like the foundation, thank you, foundation, for like everything that we do, like I promise you things will get better. Okay, the other thing I like about is my kid okay, is it's really, really important to remember that we have busy lives and that we're human beings and that we sort of, you know, are always trying to attain something. And how especially the world that we live in now doesn't privilege this idea of self-reflection. And that's the other thing that you can really, if you want to give a gift to your child or to the children that you work with, is this idea that it's important to self-reflect. That when you ask a question like, is my kid okay? You're actually asking, hey, like, I care about you, I'm attending to you, but you're also telling them, hey, it's okay to reflect on your own experience. It's okay to ask, am I okay? And the reason that that's super important is that when we talk about parenting, a huge part is modeling. A lot of times you'll hear people say that like, oh my God, you know, Jack won't talk about his feelings. And then you ask the parent, like, do you talk about your feelings? And they're like, oh my God, no way. Like, no, I'm from like the Midwest, I don't talk about feelings. I get that, but at the same time, like the idea here is, again, connection and emotions. That's what we're here for. Next slide. Okay, so topics we're gonna cover. What is psychiatry and who practices it? When you are a psychiatrist that doesn't really do stuff like this, you have to talk about your team, and so I'll talk about that for like 2 seconds. Emotions are everything. Relationships are healing. I won't really get into that. And then shame versus guilt, like the epic battle between the two. Anyone know who wins? Nobody. Everybody loses. Trick question. All right, listen up, people. Dilemmas of growing up and parenting in the modern age. That's a big one. I'm a psychiatrist. I practice evidence-based medicine, which is not really popular these days. But the last part is going to be kind of my opinion. So just keep that in mind. Next. I feel really sad. Like, actually, I choked up. We all stand on the shoulders of giants, and Dr. David Hall, who some of you may know or don't know, he was an amazing guy. He was my predecessor and my friend. He died last year. So I feel like when I give a talk like this, I think about Dave and how important he was to this community. He was like a really great guy who really cared about people and really cared about children. And I felt like we don't think or talk about Dave enough. And I really hope it's clear how much he was cared and loved. I don't think I did miss you over that. Who provides mental health? Like literally everybody. Like that's kind of what this is about. Is that you talk to kids and they'll be like, hey, like, you know, how you doing? And they're like, good. I'm like, how are your friends? I'm like, oh, not so good. You'll hear kids talk so much about how they get parentified or therapized or whatever. And I think we sort of live in this day where a lot of people are providing mental health, which in some ways is a good thing, in some ways it's not. And again, to get a little kind of racy, qualifications are important. There's a lot of people that are involved that come from a lot of different backgrounds, and it's really important to be qualified. We can get mental health. Like I had a patient tell me that like, oh, like I was sad yesterday before my appointment with you, so I like last night, and so I went on ChatGPT and I was like, hey, ChatGPT, like I'm sad, what do I do? And he did, and they said some stuff. And I think the fact of the matter is that I think we live in a day and age that we really want things as fast as possible, as quickly as possible. And even I think when we're asked for solutions, it's like, oh, my kid needs this, or I need this. It's like, we'll go on Amazon, we'll do it quick. We don't care about qualifications or substance anymore. And I think that's really a balance. Like we live here where there is a paucity of resources, where there isn't access. But I think we really have to balance, like quality shouldn't come at the cost of good care, but access is also an important thing. So I really want to say that. Next, anything else about that? The other thing, yeah, thank you. Good job. So this is a really big slide that says a lot of things. And what's funny about this is it still doesn't even begin to cover how many people are involved in mental health. Most people that come into my office are like, hi, it's really nice to meet a psychologist. And I'm like, well, I'm a psychiatrist. And the fact of the matter is a lot of people provide mental health, and a lot of people should provide mental health, and a lot of people come from different backgrounds. But I always encourage people that you're paying for a service. You should ask, right? We're all consumers. You should ask who's providing the care. What are their qualifications? I don't think that's a bad thing. I think it's a thing that it's important for us to know, when we go into someone's office, what they can do and what they can't. Because each of these people, right? The art therapist, the play therapist, the life coach, all of these people have unique roles and unique lenses that they're bringing that are just so important. And the idea behind a slide like this is not hierarchy. This is not about hierarchy. This is not about saying someone's better or worse or qualified or more qualified. It's about saying that there's a lot of nuance here. And there's a lot that each of us provide that's very different. And all of us are trying to provide mental health, but we come from very different backgrounds and very different lenses. One of my friends, Jocelyn Palmer, who is amazing, I'll brag about her in a second, talks about how a big part of this that one needs to remember is everybody on this slide, and this does not include nurse practitioners, and there's the greatest nurse practitioner of all time over there, my buddy Dorothy Hale, my student, but now a master. There's so many people on here, but the idea is that all of these people can be called therapists. And I think that's an important distinction, because when most people come and they come to mental health, they don't know exactly what kind of therapist. And I think most people that do this job, even psychiatrists, should be therapists first. And then we have other stuff as well. Okay, next slide. So a couple of things, I know it's kind of a busy slide, but clinical psychologists, so typically have PhDs or PsyDs. These are doctors of philosophy or doctors of psychology who really what their goal is to evaluate mental health of an individual. They do a lot of the psychological testing, mental health diagnoses, and a lot of them provide therapy. So psychologists are not medical doctors. That's a very important distinction. And the reason that's an important distinction is because they do a lot of stuff that I don't do. And I do a lot of stuff that they don't do. But some of the most brilliant people that I have worked with are psychologists. One of my biggest mentors, Dr. Noah Hyman, who had probably the biggest impact on me as a human being as well as a doctor, was a psychologist. Clinical social workers, so like the real heroes of mental health, if you want to be honest, right? Is that clinical social workers or social workers in general. I mean, can you talk about how we talk about how teachers are underappreciated, social workers are heroes. And I think they're heroes because they come from a variety of backgrounds. They are therapists. They always have a heart of gold. They always seem to feel like the burden of a broken system is on them. They do a lot of different things. They have lots of letters behind their names. I'm not going to pretend like I understand all of it. But I think it's an important question that when you are seeing a therapist or a social worker, to ask them. And what's cool about social workers is they truly are like the Swiss Army knife of mental health. It's like they can do case management, and they can do therapy, and then they can do this. It's pretty cool. And again, the reason I'm here and the reason that I think I'm okay at this job is because social workers have always taught me and been the greatest teachers to me. Therapists and counselors, all people with master's degrees, all people that provide mental health, all very, very important people who focus on different things and have different types of training. You have therapists and counselors that do substance abuse, they can do couples therapy, they can do family therapy. So there's a lot. And again, it's not your job to know these things, but it is probably in your best interest to ask. Nurse practitioners, Dorothy Hale, greatest of all time. So nurse practitioners, doctors essentially, we love them. What else to say about that? PAs, so physician's assistants, again. So the last two being people that are mostly coming from a medical background, as opposed to like social workers coming from what they call like a person and environment kind of background that kind of integrates what we call the biopsychosocial model. And psychologists really coming from the psychology, sort of like the doctrine and so forth. Any questions on that? Sorry, that was kind of clunky. But... All right, next one. What is a psychiatrist, right? A really existential question for me. Psychiatry is a branch of medicine. So what do I do? It's a good question. So a psychiatrist or psychiatry is a branch of medicine focused on the diagnosis, treatment, and prevention of mental, emotional, and behavioral health disorders. A psychiatrist is typically a medical doctor, MD or a DO, essentially equivalent. We know DOs, they're the best, who specializes in mental health, including substance use disorders. Psychiatrists are qualified to assess both the mental and physical aspects of psychological problems. Next slide. How do you become a psychiatrist? A lot, essentially. So it looks like typical like 12 years of education. The great Dr. Hammer, who's right behind us, who is the king of psychiatry over at Island Behavioral Health, had 12 years of training. I have a little bit more training than him because I did a child and adolescent fellowship, but he's the man. So we have to get a bachelor's degree, you have to go to medical school. So again, a psychiatrist, although kind of like fancy and mushy and likes to talk about feelings, we go to the same school that your surgeons go to and that your primary care doctors go to. We just take all the same exams, do all the same stuff, but in the end, we're like, hey, we want to talk about feelings, and then we prescribe medication. Psychiatry residency is 4 years. Your primary care doctor is typically like 3 years. So it's a big deal. And then if you do a fellowship, it's probably 2 more years after that. Fellowships in all sorts of different things: forensic psychiatry, addiction psychiatry, child and adult psychiatry, geriatrics is a fellowship, consult liaison psychiatry, a lot of training. Next slide. Okay, so what treatments do a psychiatrist do? I think this is kind of like the big thing. So a lot of people have a lot of different ideas about what psychiatrists do. the way that I like to think about it is that, and the way that I think I was taught, was we have both a biological self and we have a psychological self. And so a biological self, right, we have tissues and cells and skin and organs and all these sorts of things. And so it's science, right? And it's a scientific approach to the mind and the body. But then we also have a psychological self, right? We have dreams and fantasies and traumas and so forth. So really what I think the beauty of being a psychiatrist is that we get to sort of be at the fork in the way that I get to help people with both the biological part of their experience as well as the psychological part of their experience. And I really kind of believe that that's kind of what holds true for psychiatry, is that addressing both the biological self and the psychological self. Unfortunately, like in our field, there's like a lot of stratification, is that a lot of people are like, therapy is the best, which I agree, and I'm a big therapy guy. And the people who are medication, medication's the best. But most mental health people that I think like would agree is that it really is the combination of things, right? Is that in some cases, therapy is everything. And in some cases, medication is essential. But really all of our research that we have shown is that when you put both side to side, one on its own can be great and effective, but it's the combination of them. And I think psychiatrists really stand at the forefront of trying to integrate those two things. So we do lots of stuff. Psychotherapy, so that's just talk therapy, and those are all the different types. My favorite isn't on there. It's called psychodynamic psychotherapy. I'm just curious. Nobody was. Medications are all sorts of medications. So antidepressants, antipsychotics, stimulants, mood stabilizers, sedatives, and then we have lots of procedures. Psychiatry is a blooming field with lots of stuff. You'll notice that like what I'm talking about today is I'm not really going to talk about medications. If you guys have questions, I would love to talk about medications. But I don't really want to talk about medications because I don't want to. Because I'd rather talk about this other stuff. Because what I'm sharing with you today is what I think is like ideal. But again, I want to say is that if you guys have questions about it, medications are super important, the backbone of my practice, in addition to therapy. But I'm very passionate about psychotherapy because compared to most psychiatrists, I have like oodles and lots and lots and lots of psychotherapy training. So with that being said, next slide. Okay, so as I mentioned, the king, Dr. Hammer, is behind you. He's our medical director. Dr. DePisa, who honestly is he's from Oklahoma. He's like the cowboy psychiatrist. We have Jocelyn Palmer, who is like truly a goddess among insects. She's like an amazing person, amazing therapist, like the OG of the community. And then we have like the superstars at the bottom. We have Constance Guy, Melody Lovely, and Amy McIntyre, who are all newer additions, but essential to us. We have a really good team. We have a small team, but we are mighty, and we do the best we can. And so at the very left is me, and I do the child and adolescent psychiatry stuff. Dr. DePisa and Dr. Hammer are the adult psychiatrists, and everybody else does everything else. Nice. So who would we be without the people that support and love us, right? That's who these people are. This is our support staff. That's Ashley Heath, our manager. Ashley Johnson, who is our clinical coordinator. Brittany Chavicule, our patient appointment coordinator, who is wonderful. Henry Conyers and Jerica Quick, our nurses. We have a really good team, and if you seek care with us, you'll know that like these people are as much mental health clinicians as the rest of us. They really meet our patients with a lot of care, consideration, and thoughtfulness, and I feel very fortunate and wanted to take the opportunity to brag about them. That's excellent. Okay, so anyone know what alexithymia means?
What?
Alexithymia. So alexithymia is a condition, right? Where essentially it's hard to talk about emotions, right? Like people with eating disorders in particular are known almost, I think, like 70% of folks with eating disorders have alexithymia. And all alexithymia means like an inability to have what's called affective language skills. So the ability to speak or talk or express emotions. So really what we're talking about and kind of the crux of what I do, believe it or not, is to try to convince people, and I literally do this every day, about how important emotions are. It's a hard job to try to convince people of emotions. And the reason is because emotions get a lot of bad press. Emotions are seen as weak, as, we only like the good ones. Like if you're happy, that's good, but if you have any of the other ones, it's bad. I'm a big anger guy, like I'm the guy that's always like, let's get angry. It doesn't work. People don't like that because they don't want to get angry. And they get angry with me, so it's great. It all works. But really kind of what we're talking about and why I really want to take the time to explain this. I know a lot of you may know this already, so humor me if you already do. But emotions really are everything. And if you really care and are here to learn about how to connect with people, especially your children, it's through emotions. Connection requires emotions because an emotional connection is essential to having a good relationship. And that's what I would sort of say is that and I'll talk about this more, but the whole basis of my job and what I see my function is to help people with their relationships with themselves, their relationships with others, their relationships with medications, their relationship with food. Everything is a relationship. And it's so important to nurture those relationships. But how can you nurture something if it's devoid of emotions? Unless you feel something, how can you care about something? How can you invest yourself in something? How do we feel alive if we can't feel emotions? So emotions help us feel connected, motivated, enriched, and alive. That's everything, right? Like think about you see a movie that's boring versus you see a movie that just sort of stirs you, right? It's like how much of a different experience is it to emotionally experience something, right? To go on a journey of something rather than to just kind of go through the motions, right? Like we all have jobs. The days that you go through your job and you're just like, a robot, just can't get it done. Or you have a job, or you have a day at your job where you truly feel invigorated, where you truly feel yourself. You're connected to the people around you and connected to yourself. This is like the lifeblood of what it means to be a human being. And it's the lifeblood of what every parent needs to offer their children. Very simply, and this was kind of mind-blowing for me many moons ago when I heard about it, is all we know and all we need to know is that emotions are just simply signals. That's it. That if we just kind of we're not saying emotions are good or bad. Emotions are merely data. They're just information. So, I run into Dr. Hammer and I'm really, really excited to see Dr. Hammer. It's telling me something. It's communicating to me what I need, what I value, what I desire. So that if we're able to view emotions simply as signal, as just valuable data, that's everything. And it's such a freeing experience to do that because most of the people that I meet can't handle the experience of being sad because they feel that it has an implication about who they are, what's happening. There's a lot of connotation to the experience of being sad, or lots of kind of baggage to the experience of being angry. If I'm angry, does that mean I'm an angry person? But really what the idea is, if I get angry, you're looking at you, Pearl. Pearl calls me Shad, and I get angry with Pearl. She never would because we love her. She's great. But, sorry to pick on you.
I'm here
and
for
you
it.
never did any of these things. But if I get angry, right, all I'm really doing is that is a signal to me that I don't feel seen. I don't feel heard. I feel like, and at the very basis, I don't feel like Pearl cares enough about me. But if I'm able to look at the emotions and be curious about them, to see them as a signal, it would help me understand that, what? Pearl's opinion of me is actually really, really important. And it really hurt my feelings that she didn't know me. Rather than, oh my God, she called me Chad, and I'm such a dick for it's recorded, right? I'm such a jerk for, impressed. I'm such a knucklehead for getting upset. Because most people, they get mad and then they get so upset that they're mad. Or they get sad and they're like, oh, I'm not sad, I'm happy, I have to be happy, I'm a happy person. If I get sad, that means something about their identity. But again, if we're able to just view emotions purely as signals, purely as information, that the way that I like to think about it, and this is gonna sound weird, but remember the Wizard of Oz? At the beginning, where it's all black and white, and then it's like Technicolor comes, then she's in Oz, and it's like the most vivid reds and blues and greens. That's what a life with and without emotions is like, you know what, it's really bright and it's a lot to experience Oz, but at the same time, it's not really a life worth living if you don't get all the color. And that's what emotions are, is that like, yeah, I can watch a black and white movie, but I want to get hit in the face with colors for better or for worse, because that's what enriches my life. That's what makes me feel alive. And just because I'm feeling something, it doesn't define me. It's just a signal. It's just information or data that I shouldn't ignore, but I should just be curious about. That like, I'm kind of pissed right now. I wonder why that is. Rather than, I'm pissed. I'm like, oh, I don't want to be mad because I'm not a bad person. I'm a doctor. My wife doesn't like when I get pissed. I don't like all that. Let's just be human beings. So the last part, which I think is important, is, so, okay, this guy's talking about emotions. Should we have, okay, I'll buy that. Let's maybe be emotional once in a while. But why is it important? Emotions are so important because we need to experience our emotions and we need to understand our emotions. And then the way that we do that is by sharing our emotions and processing our emotions. And then we can learn to trust our emotions. And that last one is everything. Is because so many times we meet people who have emotions, who have difficulty expressing their emotions, but they really, really can't trust their emotions. And the reason why that's important is nowadays you hear a lot of people talk about like gaslighting, right? So it's like, you know, I called this person and I feel like they're gaslighting me. Is that I like to tell kids the number one gaslight prevention. Does everyone know what gaslighting means? Any questions about gaslighting? Okay. So gaslighting is essentially when someone tells you something and then you feel like you don't know if it's like true or not, and you feel kind of like all upset, and it's like very kind of like second guessing yourself essentially, but it's being induced by another party. And so the biggest prevention against gaslighting is to trust your own emotions. But if you have an experience and that you're used to having emotions, you're used to talking about your emotions and processing them, then you could be like, you know what, I'm really upset right now. And although that person was really nice to me, but my upsetness is telling me that something hurt my feelings. It's like, it is a fail-safe of our experience to have emotions. And really kind of like the basis of my job, which I have to say that a lot apparently, is like, that people get sick when we don't express our emotions. And our relationship with emotions is kind of the whole reason that I have a job. Excellent. Next slide. Okay. So I like this slide. Maybe I shouldn't. But essentially, like a lot of words. But essentially, if you look on the left, right, the idea is that's the way it's supposed to happen. That you're supposed to have a stressful life event, and then you have an emotional reaction. So Pearl hurts my feelings. Sorry, Pearl. And then I get sad about it, right? And then we talk about it, and then I return to normal life, and then we're best friends again. That's how it's supposed to happen. But that's kind of predicated on me, expressing my emotions, understanding my emotions, sharing them, and learning to trust them, right? But temporary means like this could be several days, right? How many times, like for people in the biz, right, do we hear like, you know, I'm still thinking about my girlfriend from when I was in high school, and I just like, I can't let go of it, and it's because it hasn't been talked about. You should never villainize someone who can't let go of something. It just means that they're not done talking about it. And that's what we need to sort of always promote people to do, not judge them for it, not ridicule them for it or ignore it, but really like to understand, why won't this go away? And it typically won't because it's not processed, it's not talked about. The reason I have a job is because of the right side. It's because of the fact that typically what happens is after stressful life events, people have emotional reactions, but then emotional reactions to and rejection of those internal experiences, the thoughts, the emotions, and the bodily sensations. We work so hard to stuff the emotional reaction down, is that rather than it moving forward to normal recovery in life, it just is a loop. It just starts all over again. So, you know, someone cuts me off in traffic, and I'm just so pissed. And then I go to work, and then someone kind of is rude to me at the front desk, and then I keep going. And then unless I kind of talk, vent, process how I'm feeling, it never goes away. It just loops. And I think that's the whole point, is that we have to process. We have to allow ourselves to have emotional reactions rather than fight them. And that what we experience is that so many people fight the experience of being a human being. And I think that's what I would advise you not to do. Next slide. Can we hit the... that slide? So this is a great video, and before we do it, I want to say that it is a promotional video for what's called the Circle of Security, which is an amazing organization. So they don't pay me, I'm not advertising them, this is just a great video.
As parents, we've all asked these kinds of questions. How can I stop my child behaving like this? What do I do to manage her behavior? Is there something wrong with him? Why would she behave like this just to get attention? But what if the problem lies in the question? If instead we ask, how can I improve my relationship with my child? And what is her behavior telling me? We start to see that the need for attention is actually a need for connection. A child's behavior is in fact a form of communication, and it is driven by this need for an emotional connection. Children need emotional connection with their parent as a secure base to go and explore the world, and they need it to be a safe haven to come back to when things get too difficult. It's possible to control your child's behavior by threats, rules, and rewards, but stickers, treats, and time out lose their effectiveness eventually. The thing that really changes them is your presence and unconditional love. The bottom line is, they are more likely to behave well when they're feeling secure in their emotional connectedness and safe in our love. Love isn't just a warm, fluffy feeling, and it certainly doesn't mean giving in to them. Far from it. Your children need you to be bigger, stronger, wiser, and kind, so you can both set limits and take the time to understand your child's emotional world and respond to it, helping them make sense of their mess and confusion. We know this isn't straightforward. That's why with Circle of Security Parenting, we try to support parents in this way of relating to their children, from newborns to teenagers and beyond. In fact, we're seeing remarkable effects when this way of thinking is applied to other important relationships as well. Whatever the question, learning to be connected is a big part of the answer.
They actually have a book called Raising a Secure Child. It's excellent. So attachment, right? Attachment theory. Maybe some of you have heard this. It's kind of the basis of everything that I do. Attachment is a child's emotional bond with their primary caregiver. So essentially what the idea is, an infant comes into the world and they are wired for connection, that we are built for connection. And the idea is that when we, so there's I think it was Winnicott that said that there is no baby without the mother, meaning that we require a caregiver. We sort of are born into an environment of relationships. And the idea is that if a child can form a strong, emotional, and secure attachment with their caregiver, it's going to inform all different parts of their development. You hear a lot of people say and kind of talk about attention. It's oh, my kids, they always need attention, or this is attention seeking, or they're so needy. I don't like hearing these things. And the reason I don't like hearing these things is because it pathologizes what's most important for relationships and most important for security, which is we all need attention. And the need for attention is actually a need for connection. A lot of times people come in, and it's typically what brings them in is like some sort of bad or sort of non-preferred behavior. But really, the idea, again, isn't to sort of change a behavior for the sake of changing it to make one's life easier, but it's really to try to understand, what is my child communicating to me when they behave a certain way? And typically we know through an attachment sort of based lens is that when kids act out, they're typically needing help. They're typically doing it in a very provocative way, but it's typically a need for connection. It's because typically we act out when we feel the most isolated, the most alienated, the most misunderstood. And so really what connection is about like understanding. And the deeper that we can like retain and fight for like as secure of a connection, the deeper and better our relationship can be. And I agree with what they said about like, the better the child feels secure in their relationships, particularly their parental relationships, it allows them a sense of resilience to be able to navigate everything. Because imagine any sort of situation you've been in, whether it's school or at work, is think about when you felt the most alienated, the most like on your own. And think about how much it would matter to have someone in your corner. That literally all of us could do anything as long as we have someone in our corner that believes in us. And that's really what this boils down to, is that, you know, there was a therapist once that told me, like, you know, parents are never the problem, but they are the solution. And I think that is so essential in understanding that, like, the connection, the security, the relationship, and the privileging of that relationship is everything. Early secure attachments, we're gonna get a little sciencey for a second, contribute to growth of a broad range of competencies, including a love of learning, a comfortable sense of oneself, positive social skills, multiple successful relationships at later ages, and a sophisticated understanding of emotions, commitment, morality, and other aspects of human relationships. Secure attachment is so important because it informs so much of what we require as adults. The ability to be able to leave a secure base, to be able to return without fear of retaliation or withdrawal. These are such essential components that get built so early on that have profound impact for all of us. Next slide. Relationships are the active ingredients of the environment's influence on healthy human development. So, like I said before, young children experience their world as an environment of relationships. When you come into the world, all you understand is relationships, because that's all you really know. And the quality of those relationships, the security of those relationships, it really literally affects how we develop. The ways that it affects development include intellectual development, social, emotional, physical, behavioral, and moral development. Healthy development depends on the quality and reliability of the young child's relationships with the important people in his or her life, both within and outside the family. We literally know that a child's brain architecture depends on the quality of these relationships. So there's a lot which talks about like the serve and return interaction between like parent and baby, the idea behind like, you know, the baby coos and then the parent's reaction to that, and how it's sort of a back and forth and creates sort of a cycle that allows the child to feel that sense of recognition. Because again, we're wired for connection. That, like, you know, unlike other animals, is that the baby cannot exist, right? The baby, like an infant's survival is evolutionary and literally biologically dependent on their ability to attach to a parent. Like, think about the profoundness of how primitive that is that if the baby does not successfully attach to its parent, it will die. Fact. And I think that is within all of us, and all of that have experienced that. And when that gets disrupted, when that gets shaken in whatever way it does, it creates a lot of problems. And it's not their fault, right? That's the best part about working with kids. It's not their fault. Next slide. And they're fun too. So why relationships matter? Why relationships matter to development? The quality and stability. This is like the third slide that says the same thing. But the quality of stability of a human's relationship in the early years lay the foundation of a wide range of later development outcomes that really matter. Self-confidence and sound mental health, motivation to learn, the ability to control aggressive impulses and resolve conflicts in nonviolent ways, knowing the difference between right and wrong, achievement in school, having the capacity to develop and sustain casual friendships, relationships, like all of this is all informed by these things. Is that even people can form relationships, but when you form a relationship, how anxious are you about it? How disorganized do you get when things don't go your way? Can you continue to connect? Can you stay connected to someone and still be mad at them? All of these things are affected by affection. And then ultimately, like, what do we all just want to be good parents. All of this matters. Next slide. So what is my job as a parent? This is my commute, but not really, because it's also back to science. So unconditional love is huge. In the words of the distinguished developmental psychologist Yuri Bronfenbrenner, in order to normally develop, a child requires progressively more complex joint activity with one or more adults who have an irrational emotional relationship with a child. Somebody's got to be crazy about that kid. That's number one. First, last, and always. I love this quote because it is so true that part of attachment is that someone, and you can meet like any kid that I've ever met, you can hear sort of the pain in their voice when there isn't someone that is crazy about them. And then sort of like the joy and sort of the fulfillment that comes if there's even just one person that's just crazy about them. And that's something like, what a gift to give a human being, but to just be crazy about them. And imagine how much that can allow them to have the resilience and kind of go through the journey of life, which we all know is very difficult, but to have someone and to be able to internalize that someone is crazy about me. Empathy. We all need more empathy. Well, maybe not women. Women maybe have too much empathy sometimes. But men, guys, we need empathy. The idea here is that, again, caretakers must find a way to, and I love this because Anna Ornstein said this, and she died recently, and she was the best. Anna Ornstein would say, caretakers must find a way to decenter from their own needs and focus and respond to what the child experiences. I love this phrase, is because the idea is not to have needs as a parent, but the idea is to decenter your needs, is that it's very important for a parent to have their needs, to express those needs, to work on those needs, to give those needs attention. But when a child needs your help, when your child is in distress, when your child or partner is going through something, the idea is, how do I maintain like an eye on my own needs, but also decenter them to be what my child needs me to be in the moment? This is another big one, which is self-awareness. Children who encounter difficulties or become symptomatic create guilt and shame in their caretakers. That's kind of the next kind of place we're going to go, is about guilt and shame. Being a parent is, everybody who is a parent in here can say that how it's the best and the worst thing. It is so challenging. It is such a task that we didn't even know that we were getting ourselves into. Well, some of us. But I think the idea basically is that there's a book called Parenting from the Inside Out, and I love that title because it specifically talks about something that's super important, which is parenting is as much about your child as it is about you. Our stuff comes out when we're a parent. And the ability to be self-aware of those things, to deal with that shame, to talk about that guilt is so essential. Because the better, I don't believe in trickle-down economics, but I do believe in trickle-down, sorry, I'm political here. But I do believe in trickle-down when it comes to children, is that every time a parent does self-care, every time a parent privileges their own experiences and tries to, do things that are best for themselves, it's like a win-win, because the parent feels better, but the child will always do better if the parent's doing better. Always. Always, always, always. So self-awareness is a huge important part as a parent, is that the idea, again, is to attend to your child, but to attend to yourself. The better that you're able to do with yourself, the better you're going to be more available for your child. Focus on the relationship. The feedback mechanism between caretaker and child, in which both parties need affirmation and validation, is not restricted to infancy and early childhood. I love this too, because it sort of really says that it is a give and take. It is serve and return. That the idea is that it makes sense that a child needs us to affirm and validate them, but it is okay for a parent to need that affirmation and validation. But what's important, and the important caveat here, is there's this paper written by Robert Caron about shame. It was written a long time ago. It's a brilliant paper, but essentially he talks about how what shame is, but he talks about how shame has been missing from the conversations of that therapists have been having in theory and so forth. And I think the more that I've done this work, the more it's made me realize how much shame plays a part in so much of what causes human distress. So what's the difference between shame and guilt? Guilt is very much my bad, right? So very simply, guilt is my bad. Shame is I am bad. Very dangerous. When you do something bad, right, you can essentially make up for it, right? I take Marta's, I go into her wallet and I take $10 because I need to buy something. I can give her $10 back. With shame is a completely different story. I can't think of something that is more corrosive and hurtful and damaging to the self than I am bad. And typically, I am bad is not solvable. It is not something that can be redeemed or you can pay a penalty and it's over. It's something that is so destructive to the self, and really the basis of a lot of what, honestly, most adult psychiatrists see. But for me, the reason why it's super important is that a lot of parents experience a lot of shame about their children's bad behavior, or not preferred, let's say bad behavior. And I think the idea is it's so important, again, to be aware of shame and guilt and how much of an impact that has. That typically when people experience shame, they feel angry, they have low self-esteem, they do self-destructive things, versus guilt, the folks that apologize or attempt to repair. But I think it's really, really important to know and to always be aware. And I guess I could talk about shame, where it comes from, for a long time. But I think the idea is really starting to notice that when you feel bad, is it because you're feeling guilty or because you're feeling ashamed? Because a lot of times when you see kids or even adults have huge out of proportional reactions, it's typically something that's based in shame. And shame is such an interesting thing because shame, I had a mentor in residency that always said, in medical school, everybody feels shame because shame is a very powerful motivator. And that's true. We kind of live in a society where shame is we shame people to get good grades. We shame people to do better at sports. It's because shame is such a powerful tool that most people use to motivate themselves. But the problem with shame is that it's acid. It gets the job done, but it causes so much damage on the self. So it's the person who's oh, I gotta be hard on myself because that's the only way I'm gonna get it done. But at the same time, is when you use such a severe and corrosive substance to get the job done, the damage is irreparable. Next slide. What can we do about shame? I promise I'm almost done with this. Not really. Nothing apparently defends against the internal ravages of shame more than security gained from parental love, especially the sort of sensitive love that sees and appreciates the child for what he or she is and is respectful of the child's feelings, differences, and peculiarities. that is the other big one, that what a parent's job is to accept your child for who they are. So much of us have been subject to other people's expectations and dreams about who we are meant to be or what's the right thing to be, when truly the biggest sacrifice that you could give as a parent is to privilege your child's needs over your own and to really allow them to be whoever they're meant to be. I was joking with Patty earlier about my son who thinks he's a dog. And that's been interesting because he licks the floor. He actually thinks he's a dog. He licks the floor, eats off the plate. My friend Morgan over there knows what I'm talking about. He does, and it's really weird. He's so weird, this guy. But I love him, and I'm allergic to dogs, but I'm gonna be a dog person because that's what this is all about. All right, enough of that. Sorry, Cairo. Nothing seems to make shame cut more deeply than the lack of that love. That essentially it's so simple, but it's so profound that all I've been talking about for the last 45 minutes is love. That, our world and our children and everybody, if we're able to approach things with true unconditional love, everything gets better. And that requires empathy, and that requires self-awareness, and that requires a focus on relationship. That's all predicated on emotions. So the psychoanalyst Leon Windsor says, if you run from shame, you may successfully avoid the humiliation you fear, but you constantly sense this anxiety within yourself and know you cannot escape it. It follows you like a shadow. And I think that's really what this is all about, is that shame, again, is so destructive. And we say that it goes underground, that it sort of haunts you. And again, I'll probably talk about this more, but long story short, the idea is to put your shame into words. And a lot of what I do with kids and their parents is that most of the time, right, when young kids are acting out, it's because they are having difficulty putting their emotions into words. And when we don't put our emotions into words, they come out in our behaviors. So when a kid freaks out and you're like, oh my God, what are you doing? It's because they're having a difficulty putting their words and their experience into words. And that's really kind of, again, the basis of what I do. Put your shame into words. The problem with shame, the other big thing about shame, why it sucks, is because of the fact that people are kind of more open to being guilty. It's sorry I was late, I feel so guilty. But shame, it thrives in the darkness. That the things that we are most shameful about, we will never tell anyone, because it's almost like a deformity, and it's something that you cannot expose. For us therapists, or folks in the mental health field, it's really our job to help people shine a light on shame, because it cannot thrive if you air it out, if you allow it to be seen, to be able to tell someone, as a therapist, if you're lucky, you have the fortune of someone telling you the thing that they most fear and feel the most humiliated about, and be able to show them that you can still love and accept that person in the face of the thing that they think that makes them the most unlovable. And that's what shame's really about, is that it makes you feel unlovable. And it makes you feel like at the core you are bad. And a lot of kids freak out because when they do something wrong, they can't tolerate it. It's the shame that drives them to act out. And it's usually because they can't put it into words. And it's our job as parents, or adults, or teachers, or whatever, as the big kids in the room, to help our children sort out those complex feelings and continue to encourage and push them to put those things into words. Next slide. Okay, we're almost done. Okay, so how challenging is it to grow? This is the part that's not evidence-based. This is just my opinion, so take it as you will. Social media. Actually, I'm going to back up for a second. It is so hard to grow up right now. And it is so hard to be a parent right now. And I think this idea is fraught with like so much judgment and criticism. But I think if we like stop for a second and just are like, holy crap, I just feel sorry for everybody. I feel sorry for the kids that have to grow up this way. I feel sorry for the parents that have to deal with all this stuff. Is like, maybe if we stop for a second and just like appreciated each other for how hard we're working and how much we're trying our best, that it just wouldn't feel so crappy all the time. Is that everyone is really trying their best. And the kids today have so much to navigate. It just seems to me so unfair what they have to do, because I think if I had to grow up right now, I don't know if I could do it. It's terrible. Social media has changed everything, and there's people on both sides. The problem with social media, again, is how artificial it is. And I think parents, we are to blame as much as anyone else. We buy into it too. But then when it's not convenient or it's weird, right? We'll take pictures with our friends and post it, but then, your kid's on Facebook or like Snapchat. It's like, all of these things are meant to be used. All of these things are created because they sort of like promote socialness, but all they really do is isolate. Social media is something that I think a lot of people are like, what should I do? Should I be on social media or should I not be on social? Should I let my kid? There's a book called The Anxious Generation that I'm sure a lot of you have heard about. That guy is really smart. You should do what that guy says. It's like really good. And basically what he says is like, it's really, really important to try to regulate these things. And I think, again, the idea is that a lot of parents come in and they're just like, well, the kid did this and we're not gonna do that anymore. And I think the idea that I would sort of encourage all of you to think about is everything requires a discussion. That when you take choice away, you're not really teaching children. The whole point of when you're trying to help a child with their behavior is to make it a learning or a growth opportunity, not for it to be punishment. The problem with punishment is that there's no learning or growth, right? If you think about, like, unfortunately, I'm gonna get political again, sorry, is like the prison system, right? Or prison reform, is that it's based in punishment. It's not based on rehabilitation or learning. Well, in some cases it is, hopefully, right, if you're motivated. But I think the idea here is that there's no learning or growth that comes from punishment. And I think that's the piece that makes it very, very hard, is that we want children to have choices so they can learn to make good choices. Because if you're like, okay, no social media ever, they're never going to learn to navigate that kind of stuff, right? Because whether we like it or not, social media is here to stay. And if it's not social media, it's gonna be something else. But the idea is, how do we walk along with our child and help them navigate things, rather than create some sort of weird dynamic where, like, me know everything and you don't know anything, like, let's not be Neanderthals. Just kidding. Sorry, I didn't want to do that. I've never even used that voice before.
Who is that?
Yeah, so there we go. Technology. Yeah, oh my gosh, like, how fast is that moving? And how crazy is that? And who knows what's gonna happen, right? It's like, you would think that, like, how much school has changed and how much that's gonna impact things. Is that, if you don't buy into the technology piece, that would be nice. But at the same time, what are you doing to someone when you actually are making them incompetent in the things that they're probably gonna use at a later date? And again, technology confuses everything. It makes us more, it creates a lot of opportunities, but a lot of barriers. I don't think we had to deal with that before the way that we have to now. And it's simply the speed of it. So gender or sexual norms, pretty hot topic. Gets people pretty incensed about a lot of stuff. But again, there's a lot to say about that. I don't know if you guys want to talk about it. I'm happy to talk about it. But I think really what the idea, and I think if I'm gonna just say something about the gender and sexual norms, is I really think what the idea is that children are trying to figure out who they are. And whether you think that sort of the gender and sexual norms, you approve of them or not, that's your choice. But one thing that you have to remember is children are trying to figure out who they are. And the more that we oppose that experience, the more that we choose not to be fellow journeymen on that experience, the more you're likely to alienate your child. And I think we have to respect the process of figuring out who you are. And I think that's what parents, whether you agree with what your kid thinks or feels, and I'm not saying you gotta do whatever you gotta do, that's your choice. But what I would sort of say is, what a sacred duty for every parent to try to be part of the process that your child figures out who they are. And I think that's what I would sort of promote above political belief, about, religious stances or standards, is that the idea is, how do you allow yourself to be part of the process in which your child figures out who they are? And that's an honor and a privilege that I think any parent would die to be part of. COVID ruined everything. It's their September 11th, or the Kennedy assassination, or whichever kind of huge life-changing event. We don't give kids enough credit. We don't give them, we expect so much of them when they go from summer. I've been saying this a lot recently, they go from summer to school, and it's it's been 2 weeks, how come, he or she is not getting it right? And it's bro, it's been 2 weeks. We have to give children more credit. And I think COVID was very traumatic and impactful. And I don't think we even fully understand how it's going to shape them and continue to shape them. But it's something important to talk about and to take into context. Education is evolving, right? When I started doing child and adult psychiatry, the psychiatrists were always all right, as a child and adult psychiatrist, you always have to fight homeschooling. Homeschooling is no on homeschooling, because we're very pro-social. And when I started doing this, I was whenever someone would be we're homeschooling now, I'd be no, we don't do that, that's not good. Boy, has that changed, right? It's because if you want to do the work that I do, you have to accept homeschool, because it's such a huge part of what's going on. And I'm not really sure what the right thing to do or what the wrong thing to do is. I'm not an education specialist, but I would say school is not just about learning. It's also about social learning. And I think it's so important for kids to be around their peers. That's all I'm saying. Finances. Oh my God. I have never expected to talk so much about money with kids in my whole life. The world is crazy. Inflation is affecting the children. The number of kids that I have talked to, it's pretty startling about how financially conscious children are, and how much they worry about finances, and how the idea of even taking a student loan out, the millennials, we ruined it. They're so afraid. And not that they shouldn't, because those are predatory practices, but at the same time, right? There's a little bit of nuance, right? Where in the sense of I never expected to hear so much anxiety about financial stuff. And I think you think about it now is if, they used to say back in the day, that when you start doing child analysis work, they're if there's a bad parent, they would say, we do a parentectomy, right? Which basically means cut the parent out. And usually that happens when you turn 18, right? So then you could just move out, move in with your boyfriend, girlfriend, your best friend, pay $300 in rent, and then, live in some cardboard box and it'll be okay, right? Who can afford to move out right now? It is preposterous that right now the financial world is not allowing kids to naturally go through a phase of development called separation individuation, where you sort of have to deal with this sort of conflicted feeling of the world calling you, but afraid to leave the nest. But they can't leave the nest because they literally cannot afford it, which is crazy. So feel bad for these guys. Different breed of parents. Parents have changed a lot. A lot. In good ways and in bad ways. Yeah, I'll talk about that. Next slide. So how challenging it is to be a parent. I just copied the slide. Literally. Because I was trying to be funny and ironic. Next slide. Okay, so there's a couple things that, and again, I promise I think this is the last thing I'm going to say. When our parents or like our grandparents talked about their parents, when growing, like great grandpa Joe was on the farm, and then great grandpa Mark was on his farm. If you think about how much has changed from generation to generation, it really didn't change like that much. It changed, but not as radically as things have changed now. Is that if you think about how fast the change that's occurring from generation to generation, it is like bananas. How much our experience as children is different from like the children of today. And that's only getting faster. And I think that presents such a unique problem and difficulty for parents. And the difficulty isn't that I don't think the parents can handle it. The difficulty is it requires so much more empathy. And it requires such discipline in wanting to understand your child's internal experience, because the fact of the matter is you have no idea what they're facing. Because we can't relate to it. And I think it's a mistake to pretend that you can. The idea is your child is an expert on like their life and their experience. And I think good parents are good students, are like wanting to learn. And I think that's what I encourage all of you to do, is don't try to pretend like you know everything. That what you can really teach, like the smartest people I've ever met are the ones that say like, you're like, hey, what do you think about this? And they're like, I don't know. Because if someone's literally able to say, I don't know, the amount of confidence it takes to be like, I'm gonna be vulnerable and I need you to explain something to me, that's what a smart person does. And I think smart parents don't know, but they're interested and they're committed to learning the answer. Oh God, parenting culture. Holy cannoli. Why are we so mean? Right? Like, I think like, I was telling Elise this, like bullying, like talk about bullying and shame and guilt and competition. Like, that's the scariest part for me for being a parent, is like how much we compete, how much we use social media to be like, look, I'm on a great vacation and you don't have money, that's cool. Or like, my kid got into Harvard and yours went to Yale, like you suck. Like, it doesn't make sense, right? But I think this is a really important part that I don't think we talk about enough, about how toxic parenting culture is and how shaming it is and how it's based in competition and comparisons. And as common sort of therapist phrase is compare and despair. Like in social media, parenting culture, all of these things are shame-based. And I think we as parents have to fight these things. Political polarity. Things are pretty bad right now. It's so hard to not pick sides. And it's so hard to know what the right thing to do is. Everybody has an opinion, and everybody's scared to share their opinion. Or if they're not scared, they're kind of obnoxious about it. It's very, very challenging. I don't remember it being like this. Maybe some of you do, like in freaking World War I or something. But political polarity, like, is a real problem, and it really does affect parenting, because a lot of like legislation, a lot of the decisions that are being made really affect parents, right? Like Elise, and a shout out to Elise, by the way. Elise really is one of the biggest reasons that I'm still here, in the sense that she has really invested in me to stay here, and I recently renewed the contract for 3 years. And I would say that if Elise had not made that possible, I wouldn't be here. So I think that is a testament to her commitment to like child and adolescent psychiatry in this community. So thank you, Elise. And I need a raise, just kidding. Had to ask. So what was I talking about? I don't even remember. That was like polarity. Thank you. So The polarity is difficult, and I think the polarity is difficult because it informs a lot of our decisions. And I think polarity typically comes in is that a lot of families fight with each other over these polarities, and they can be extremely detrimental to relationships. And I think it's really important to be cognizant of these things. Self-care, I love this one because if you can remember, the title of the talk was, "Is my kid okay?" And I asked, "Are you okay?" Self-care is very, very important. One of the best papers I ever read, I told Dorothy this actually, was about a great article that I read about most substance abuse articles talk about a wide variety of things, but I never read an article about recovery, like how people, about relapse, like who relapses on substances or why they relapse. And basically what the crux of the article was is that people who relapse on substances do so because of lack of self-care. And it's because of the fact that most people have a difficulty distinguishing between selfishness and self-care. Selfishness is taking more than you need. Self-care is taking exactly what you need. And I think that's what I would sort of say to all of you is that if your child is struggling, take care of yourself and take care of your child. It shouldn't be an either or. There's no space to be messy anymore. And I think that's kind of also the parenting culture piece is, the problem with social media is it's so manicured and it only shows, and I think this goes back to when you're in medical school, there's like a common sort of idea that when people talk about how good they're doing in school, they only talk about their successes. They never talk about they talk about every exam that they aced. They never talk about the exam that they failed. And I think that's what social media does, is that people only highlight their successes. They never highlight the human experience of that our lives are checkered with failure, because that's normal. That's part of being a human being. And I think I really feel for parents because I think there isn't the same room to be messy or authentic because it's vulnerable and can be exploited. And that most importantly for parents, it's important to be good enough. Donald Winnicott, one of the famous psychoanalysts, who's the best, talks about how the idea is to be good enough, not to be perfect. That the best parents are ordinary people who make mistakes, who are fallible and vulnerable, but they're loving and they're caring and they're not perfectionistic. And I think that's what you want to instill in your children, that it's okay to make mistakes and that perfectionism is a trap. That's it. Any questions?
Plethora of questions for you,
Okay.
sir.
We can also take them from the audience if you'd like, Dr.
Yeah, why don't we start with any questions from the audience? All right. Hello.
Hi, I had a question.
Sure.
The difference between psychiatrists and, like you said, a practitioner of